are you? My name is Arlia and I'm going to be a nurse today. Before we start, can I get your first name, last name, and your date of birth? I'm going to take that information and verify that with her wristband, and I'm going to verify that with my MAR also. After that, I'll be informing my patient about the medication that she'll be receiving. So today you'll be receiving Primaxine. You're going to get IV piggyback, and it's a broad spectrum antibiotic. So she had some type of infection, and that's why she's getting the medication. I also asked the patient about allergies, and I look at her armband to see if she has any allergies. The patient confirmed no allergies. I would specifically be looking for any type of allergy to vancomycin. The patient is not having any, well, she also said she doesn't have any, well, I looked at her MAR, she doesn't have any contraindications for the medication. So I'm gonna go ahead and get started. I'm gonna make sure I have the right drug, which is the Primaxine, which is 500 milligrams. I'm giving it in a 50 milliliter bag. So my drip rate would be 25 GCT per minute, and then if I was on the pump, it would be 100 milliliters. And my drip rate was 15 if I didn't say it already. Well, my drip factor was 15 if I didn't say it already. So I'm just gonna go ahead and get started. I perform hand hygiene. I'm gonna go ahead and put on my gloves. So what I'm going to do first is check the IV and make sure it's patent, which I would have a flush for that. I don't have my flush on hand, so I'm just going to simulate that I would flush the IV, and then I would pull back. Before I did that, I would use my alcohol prep though. So I have my alcohol prep. I'm gonna flush it and then pull back and make sure it's aspirated to make sure it's patent. And then I'm gonna get started. So what I'm gonna do first is go ahead and spike my line. And this is sterile from out the bag, so I don't have to wipe it off with any alcohol. So I'm going to spike my line, and then I'm going to prime the line here. Move my trash can over. I'm going to go ahead and hang my piggyback higher than my primary, and I'll change that. From there, I'm going to open my line slot so that I can prime it. My gloves are kind of big. Okay, ready. So I'm going to go ahead and prime the line, make sure there's no elbows in there. And I checked for elbows, there was none. So from there, I would scrub the hub again up here, and I would secure it, and I would go ahead and open, make sure both of my lines are open, and then I would hang this lower, and then from here everything should be going through fine. I'm going to check, make sure everything is open. Alrighty, so some pre-assessment that the patient needed this medication would be, that the patient needed the medication would be sputum cultures or any type of culture that show bacterial growth, elevated white blood cell count, maybe the patient had a temperature, but some form of infection that it's a possibility they could have. Upstep provider or myself know about that. They also could experience having a UTI, and to let me know if they have any ringing of the ears, because that could indicate ototoxicity. Also document how well the patient handled the medication, and the time I gave it, the route I gave it, and just making sure my documentation is clear.